Okay. Um, Good afternoon or good morning to you, wherever you are. My name is Matt Pickering. I am the technical lead of the endorsement maintenance work here at Battelle. It's a pleasure today to showcase and walk through the new process that will be looking at endorsing quality measures under Battelle. And before we get started today, I just wanted to draw your attention to some of those introductory slides, and some folks may have been hopping on as we've transitioned to the main deck here. I just wanted to let folks know that attendees are muted today. However, if you have questions, you can submit them throughout the presentation today. You can do so by looking at the Zoom platform, and at the bottom there's a Q&A function. So if you click on that, you can submit questions to Battelle for us to answer. We'll be answering questions at the end of the call today. So please feel free to submit questions at any time, and we'll just reserve those for when we get to the end of the call today during the designated portion of the meeting today to answer those questions. We also may not answer every single question today, so we will be providing frequently asked questions or an FAQ document shortly after the meeting later on in the coming weeks that will be providing responses to any questions we did not get a chance to answer today. So also, this presentation is for the endorsement and maintenance work. So if you wish to learn more about the pre-rulemaking process or the measure set review, which were formerly called the Measure Applications Partnership or MAP, there will also be an informational webinar about this new process and procedures on July 10th from 2 to 4 p.m. Public commenting is open actually for two guidebooks, one for E&M, for the endorsement and maintenance work, and also for the pre-rulemaking process. So the primer guidebook is what it's referred to. So those are open for public comment until designated times. For E&M, you have until July 30th to submit comments on the endorsement and maintenance guidebook. Now, I would like to also now introduce and welcome Nicole Brennan, who is our executive director over this work, to provide an overview of what we'll be discussing today and introduce those to Battelle and PQM, which is the Partnership for Quality Measurement. So, Nicole?
Great. Thanks, Matt. Can you hear me okay?
Yes.
Great. Thank you, everyone. Reiterating Matt's welcome, and also wanting to say, Battelle is honored to be taking on this extraordinarily important work, and it's not at all lost on anyone on our team how important this work has been to this community in the past and how important it's going to be in the future. We are excited to have so many participants signed up for it to see us today, and just really hope this is the beginning of a long partnership with you in our mission to collaboratively improve the health and well-being of all peoples. Next slide. We have on the call today myself. You'll also hear from Brenna Rabel, who is our deputy director. You just heard from Matthew Pickering, who is the endorsement and maintenance technical lead. And then also on the call is Jeff Geppert, who is our senior research leader here at Battelle and our measure science expert for the work. Next slide. Let's say we have three overarching goals today. So first, we want to introduce ourselves, Battelle, as well as the Partnership for Quality Measurement. Then Brenna is going to go over the changes in the endorsement and maintenance process and sort of detail out why we made those changes. And then you're going to hear from Matt, who's going to provide specificity on all of those changes and how they will be rolled out and really operationalized in the coming months. And then finally, we'll end with sort of engaging with you in questions and answers, and also letting you know how you can continue to engage with the Partnership for Quality Measurement. So before I go too far, and because a lot of people are still signing on, I just want to say, please go to the Partnership for Quality Measurement website. We will post the link in the chat for you. We have the guidebooks up on the website. The one for endorsement and maintenance provides even more detail and lots of great visuals for everything that you're going to see today. And we also want you to become a member of PQM. It's so important that your voice is heard in this process and that we hear from both you individually, and then from your organizations as well. Next slide. So today is really the first time anyone's going to hear from us with a lot of specificity on the processes that we are looking to start in October. We have set aside 2 hours for this presentation. So as you can imagine, there's a lot of detail. And I just want to say the summary of which rolls up to be, after talking to stakeholders, we have tried to design a more efficient and transparent process, which is meant to serve the communities that are truly impacted by clinical quality measures. To do that, we have tried to reduce the number of committees that are individually reviewing the measures, restructure those committees, but in turn, dramatically increase the number of people who will review and vote on the measures, and also placing a large emphasis on public comment. When you comment on a measure, we want you to know we're seeing it, reading it, and it has meaning to us. So as you can see on this slide, we're kind of breaking down some of the major enhancements to the endorsement and maintenance process. First, the scientific methods panel will be focusing on advancing measure science. Public comment will occur before measure details go over to the committees to review so that they have those comments and are able to adjudicate them, talk about them, and take them into consideration. We've restructured committees in such a way that we are really trying to drive to consensus. So we've implemented a new technique that is meant for that process specifically. There are fewer committees, which includes us retiring the Consensus Standards Approval Committee, also known as the CSAC, but we've also in turn implemented and designed a more robust appeals process. So like I said, you're going to hear a lot more about this as we go on, but we just kind of wanted to lay that out there for you up front so that you know what you're about to take in a lot of information on. Next slide. Okay, and next. Battelle has really been part of the healthcare quality improvement world for more than 2 decades. We have been proud to represent measure developers and patients, clinicians over the past decade as the measures management system contractor for CMS, really looking at ways to create a more efficient and effective measure life cycle, as well as make it as accessible to measure developers as possible. So a very structured process, but then one that also encourages creativity. Next slide. With that, we have become a CMS certified consensus-based entity. We've had that for several years now, and as part of that consensus-based entity, we were awarded the CMS National Consensus Development Contract, which was formerly owned by NQF. So the work that you're going to hear about today was previously funded and worked by the National Quality Forum and has transitioned over to Battelle. Next slide. To really facilitate the work of our consensus-based entity, Battelle launched the Partnership for Quality Measurement. That is our membership group. It is meant to be a collaborative partnership for experts in the healthcare community. And what do we mean by experts? That's lived experience, education, training. We want everybody who wants to be involved, who is impacted by healthcare, to be part of the PQM. And that is our vision. So there is no cost to being a member. We just ask that you participate, that you submit a public comment or look to join a committee. Check out our website and see what is available for you and what is accessible and doable for you. We want to hear from you and make this as transparent and effective a process as possible. Next slide. I want to go into an extraordinary amount of detail today on sort of all the things we're doing under the consensus-based entity. But I want to reinforce that we are setting up a lot of feedback loops. We want every part of what we do, including endorsement and maintenance and pre-rulemaking review, recommendations for what measures go into CMS and what measures come out of their portfolio. All of those things should be connected and informing each other so that things are not happening in silos, but we are collectively moving the healthcare system forward and have a common vision for how to do so. Matt mentioned earlier that we are doing a webinar on the pre-rulemaking process in another week or two. You can sign up for that. We'll go into a lot of detail there on that process, and would love for you to be engaged in that as well. Next slide. So with that, let me please turn things over to my colleague, Brenna Rabel, who is going to start talking through the new endorsement and maintenance process. Thank you again for joining us today.
Thanks, Nicole. So I wanted to just, before we dive into the full process, take a moment to remind everyone of the existing CBE endorsement process to do a little bit of level setting so that you can put into context some of the changes that we are suggesting. So as it stands, it's a 2-cycle process, one that happens in fall and the other that kicks off in spring. And each of those cycles takes from 9 to 12 months to complete, which means that those cycles tend to run into each other from cycle to cycle. There are 14 topic-specific standing committees that are convened as needed to review measures each cycle. Complex measures have been reviewed by a scientific methods panel, which is a step that's intended to bring a greater degree of measure science expertise to the review of scientific acceptability. And then finally, all measures are re-adjudicated by the CSAC, or the Consensus Standards Approval Committee, to ratify endorsement decisions sent up from those standing committees. So sort of to summarize, under this model, a complex measure will be reviewed 4 times. So first by the SMP, then by the standing committee during the endorsement discussion, by the standing committee again, post public comment, and then finally by the CSAC. And that's assuming that an appeal hasn't been requested. So next slide, please. So coming into this work, we were fortunate to be able to build off of the processes and lessons learned from the existing CBE work. And with that in mind, we have kind of 4 overarching goals that we're aiming to reach with the changes that we've proposed. And those come down to reducing the timeline and increasing efficiency overall, improving transparency, increasing consistency across committees and years, and then promoting even wider participation among stakeholders and participants. And so with that in mind, as Nicole sort of teed up, you're going to hear details about how we aim to conduct our E&M process within 6 months, reduce the number of committees reviewing each measure, and how we're going to aim to improve consistency in how the measure evaluation criteria are applied and discussed across all of those committees. And go to the next slide. I won't spend a lot of time here, but I wanted to provide a visual to illustrate the changes in timeline from the previous process to the new one. So on the left, we have the timeline for a single cycle of the prior E&M process, which spans about 15 months. And on the right is the timeline for a cycle of the new E&M process. By eliminating a couple of phases of measure review and allowing for public comment to occur concurrent with internal staff assessments, we've been able to get this timeline down to 6 months from start to finish, including the appeals process. And as Nicole said, we're going to be talking in some detail about these changes in the coming slides. We can move on to the next one. So we are going to continue to maintain 2 cycles per year, though we will allow measure developers and stewards to complete intent to submit forms on a rolling basis. The intent to submit deadline for fall 2023 is going to be October 1st, about a month and a half before the full submission deadline. And then for any measures that are actually reviewed during the fall 2023 cycle, you should be able to expect endorsement decisions to be made by February of 2024. Next slide. Okay, so Nicole touched on this, but I'm sure by now you all just really want to know what this new process is actually going to look like. So let's get into it. The box on the right here shows the CBE process that we plan to operationalize for the upcoming cycle, pending your input via public comment. The first major change you'll see is that we plan to repurpose the Scientific Methods Panel, or the SMP, such that they participate in activities that leverage their considerable knowledge and expertise to help us advance measure science and to save some time in the actual endorsement process. So instead, our internal staff, many of whom are measure scientists or methodologists in their own right, are going to be conducting preliminary assessments concurrent with public comment review of those measures. We're then going to be leveraging a novel hybrid Delphi and nominal groups technique, which is a rigorous, evidence-based approach to consensus building throughout the process. Further, we're going to be reducing the number of standing committees from 14 to 5 to promote efficiency and consistency. And finally, as Nicole mentioned, we're going to be retiring the CSAC, allowing the standing committee recommendations to stand alone as final endorsement decisions pending appeals. So let's go to the next slide so I can talk you through some of these changes in more detail. Thank you. So starting with repurposing the SMP to advance measure science, as I said, they're no longer going to be reviewing measures as a direct part of the E&M process. And we're going to leverage that expertise a little bit differently so that we don't lose that, that knowledge from our work. It's going to allow for both an increase in timeline flexibility and efficiency in the period between intent to submit and committee review. And it's going to let us engage the SMP hopefully more meaningfully to advise on future enhancements to the E&M process. So the next steps there for us are going to be to invite SMP members to continue to work with us to inform potential efforts that will advance measure science around, sort of key priorities and emerging issues. And then also to help us make updates to the measure evaluation criteria and the process overall as needed. Next slide. So we're also, as I mentioned, going to be doing public comment concurrent with our internal staff reviews. So this is mostly an efficiency measure to make sure that we are getting lots of good input on measures without sacrificing the reduced timeline. So it's going to allow for us to compile and synthesize those comments that are submitted when we pull together our initial reports on the measures for the committees to do their reviews. So it goes back to Nicole's point about trying to make sure that public comments are included in a really meaningful way in the committee discussions. So the next step there are for us to publicize the measures that are available for public comment among the folks that are on our listservs and in our partners listservs. And that again will be happening after the intent to submit deadline in October. Next slide. Now I referenced leveraging this novel hybrid Delphi and nominal groups technique, which is a very long name for a process that we hope will help us to improve the consistency of how measure evaluation criteria are applied across measures, across committees, and across cycles. It is a process that's intended to maximize the inputs of a wide variety of voices to mitigate, the effects of one or two very loud voices from swaying the rest of the group. And overall is as I said, a very rigorous and evidence-based approach to building consensus and focusing on areas of disagreement to build that consensus. So the next steps on our end after this are, once we've recruited our committee members, will be to provide some education, both in the form of written materials and webinars, to make the details of that technique and their inputs available to committee members. Next slide. I also mentioned streamlining the number of committees, reducing the number of standing committees from 14 topic-based committees to 5 more generalized committees. And the idea here is to allow for a greater degree of flexibility and distribution of effort among committee members. We're going to have subject matters brought in as needed So if there are very detailed conversations that need to be had about a specialty that isn't otherwise represented on a committee, those voices will be brought in on an ad hoc basis. But that allows those individuals to step in as needed, as opposed to having to commit to a full committee membership requirement, especially if it's unlikely that they're going to encounter other measures within their specialty in a given year. So we'll be sharing the final committee structure. You're going to see a lot more detail about that with Matt in a few minutes here. And then, of course, all of those materials are going to be available for public comment. And you'll be able to see that the nominations period is opening on our website today, which will provide even more information. Next slide, please. And finally, we're going to be retiring the CSAC, which empowers the endorsement and maintenance standing committees to make this sort of final recommendations about measures. So this does assist us in reducing the overall endorsement timeline, which was a major goal of ours. But the added benefit here is that it increases the power of each of the standing committees, and by extension, the voices of the individuals on those committees, many of whom would be directly impacted by the use of the quality measures being reviewed, like people like patients and caregivers and advocates, purchasers, and clinicians. So our aim here is to reduce redundancies in the process so that we're not re-adjudicating the same measure at 4 different instances throughout the process, but then also making sure that the decision makers in the process are those that are sort of the intended audience and that represent the people that are most likely to be impacted. All right, we'll go to the next slide. To mitigate that change and to make sure that we're not losing the very important step of making sure that measures have gone through the process correctly, we are establishing a very robust appeals process. So there's going to be a lot of informational material, technical support, and an increase in awareness about how the appeals process works, how to make appeals, and how appeals decisions are made. The appeals committee is going to be staffed by a combination of our staff, in addition to E&M committee co-chairs and others as needed. The aim is for this process to be flexible, very nimble, able to be convened on a dime, essentially. And the aim is for us to be able to make sure that when asked, that measures have gone through the process correctly without without adding a risk of duplicative or contradictory measure discussions. So we'll be talking in some more detail about that appeals process later in this webinar, and then we'll be sending out additional educational materials down the line. Next slide. So with that, I'm going to turn it over to Matt Pickering to get into some detail about how the E&M committees will be structured and how our consensus building techniques are going to be applied to that approach.
Great, thanks, Brenna. And can you hear me okay?
Yep.
Thank you. So again, if you have questions, you can submit those at any point in this presentation using the Q&A function at the bottom of the screen or your Zoom platform. And then we will get to that towards the end of the call today as we go through those questions and answer them. And I'll also just mention to all those on the call, this meeting is being recorded. It will be posted shortly after the presentation today. So we just wanted to recognize that as well. And for all of those, E&M, when we're referring to E&M, so it's E and M is endorsement and maintenance. So if you hear us talking about that, or if I say E&M, we're specifically talking about the endorsement and maintenance of quality measures. If you've heard the term PRIMR or MSR, that is the Measure Applications Partnership. PRIMR is PRMR, and of course, MSR is MSR. So that was formerly the Measure Applications Partnership. So I just wanted to remind folks of those acronyms as we're using them today. So as Brenna mentioned, I'll be talking more about the committee structure and then also the process for evaluating measures. So first is just the committee structure and overview here. As we mentioned, we're really trying to streamline the number of committees to be more generalizable, as well as committees that really explain or follow the patient journey through healthcare. So previously, we had 14 committees, and that included also, if you added CSAC and the S&P, that's 16 total groups that would be convened, and then plus the appeals board as well. So we wanted to reduce that down to 5. Now, this is not a 1-for-1 type of mapping here. It's not even a 2 or 3 or 4-to-1 mapping. Really, it's really trying to look at these projects, as you see listed on the right side of the screen, and the committees that will support them following the patient journey. So you have primary prevention, which focuses on the prevention of disease before it occurs. You have initial recognition and management, which considers measures that address early signs and symptoms of conditions and diseases, early recognition and management of those, and changes in a person's health status, for example. It also can include areas around patient safety or harm, diagnostic excellence, as well as recognition of a condition. Followed that is management of acute events, chronic disease, even surgery or behavioral health. So this committee and this project will really focus on the disease management, improving the quality of life for individuals with acute and chronic conditions by minimizing and preventing the disease effects through quality care. End-of-life care and rescue specialized interventions really considers measures that address advanced terminal illness and end-stage disease, such as end-stage renal disease, for example. And then we have cost and efficiency. So this is a committee, and the measures that are submitted for, or cost measures that are submitted to this committee are very unique in and of themselves. So this committee and this project, cost and efficiency, will consider measures that focus on total healthcare spending for a healthcare service or a group of services associated with specified patient population, a time period, or a unit of clinical accountability. Next slide, please. So each one of those 5 projects, like I said, has committees that will support them. And here you can see a breakdown of the numbers and even further subgroups within those committees. So you can see the top row is the 5 projects that were just on the previous slide, but each committee will be consisted of about 60 people max. Now those 60 people will be subgrouped into an advisory group and a recommendations group. And you can see the numbers associated with what we would try to achieve for both of those subgroups. So advisory and recommendations groups individually review measures independently in advance of an endorsement meeting, and the recommendation group meets to review and discuss areas of non-consensus based on that independent review. So I just want to emphasize this. So when the groups, when there's an endorsement meeting, only the recommendations group is convened to discuss the issues that were identified during the independent reviews from the entire committee. The advisory group members are invited to listen in to those conversations, because at the very end of the discussion during the endorsement meeting, the entire committee, advisory group and recommendations group, will vote on the final endorsement decision. And this is important also because we're not voting on every single aspect of criteria or the rubric that we'll be using to evaluate measures. Rather, we'll be discussing any areas of non-consensus based on the independent reviews that occurred prior to the meeting. And then there'll be one vote, a final vote on the endorsement decision at the end of the call. And we'll kind of go through that a little bit more as we move forward. Next slide, please. So this slide just draws attention to what I was just mentioning between these 2 groups. So both groups make up the entire committee. The advisor group, they review and provide ratings and written recommendations on the measures. So they do so independently prior to the endorsement meeting. And they also attend that recommendations group meeting, which is the endorsement meeting. And at the very end of that meeting, the entire group, recommendations and advisory, will be convened to vote on the measures and render an endorsement decision. For the recommendations group, they also review and provide ratings and written recommendations on measures independently prior to the meeting, and any areas of disagreement across the entire committee. So that's the advisor group and recommendations group. Any areas of disagreement based on their individual assessments of the measures based on the rubric that we'll be using to evaluate them are brought forward during the endorsement meeting to discuss and try to come to consensus on those areas where consensus is lacking. After those facilitated discussions, again, we'll reconvene the entire group, the entire committee, advisory and recommendations group, to render a final endorsement decision on the measures reviewed. Next slide, please. Here is a breakdown of the types of perspectives that we will seek to achieve on each one of the committees, and even broken down by subgroup. So you can see we want to really make sure that the patient voice is still a center point of this work, and really reserving seats for patients, families, caregivers, and patient advocates across both groups, right? So the advisor group would have about 9 of those patient or individuals from the patient community, and the recommendations group would have at minimum 3 to participate in the recommendations group. We also have seats for clinicians, right? Nurses, pharmacists, et cetera, as well as representatives that work within accountable care organizations, hospitals, health systems, representatives from purchasers and plans, as well as rural and health equity experts. We want to ensure that we receive that feedback and perspectives from those individuals that are caring for patients within medically underserved areas, but also patients that reside in those areas as well and may have difficulty accessing care. So we also want to ensure we have researchers and methodologists on these committees as well. They could be with health services research or research in alternative payment models and population health, and other interested parties where it's needed. So that could be representatives from that know EHR systems quite well, as well as any provider or specialty associations, et cetera. Next slide, please. So we talked about briefly mentioned this novel hybrid Delphi and nominal groups technique. So this sort of starts to talk a little bit about it, where that Delphi group is going to be the advisor group, and the nominal group will be the recommendations group. Now, members of both these groups will be assigned randomly every year within those roster categories, except for the co-chairs that will be designated for that committee. So every year, we'll just randomly assign who's going to be in an advisor group and who will be in the recommendations group, and that will be maintained throughout the year. And then when we go through another nominations process, there'll be another assignment that will happen to the recommendations group or advisor group. And as needed, during those recommendation group meetings, which is the endorsement meeting, we will bring in any subject matter experts to provide more context and relevance to the discussions. Next slide, please. So nominations, well, they're open, actually. So we have open nominations for all E&M committees, those 5 that we were just talking about. But also nominations is open for anyone interested in the primer or MSR. Remember, that was the pre-rule making recommendations and measure set review process. That's formerly called the MAP. So nominations are open for primer, MSR, and E&M right now. We will try to seat individuals to one of those 5 projects that we talked about on slide 23. And member responsibilities here is really to be available for the committee meetings, as well as to evaluate, discuss, and rate those measures that are under review. Co-chairs, there will be 2 co-chairs for each committee, and they'll have additional roles with committee facilitation and helping to support the Battelle staff in running through the meeting deliberations. The term limits, so members will be 3 years. Now, for fall 2023, which is the nominations period that we just opened today, for fall 2023, we're going to stagger terms just to continue to provide that staggering approach moving forward. So we only have a certain number of people, about a third of people will be rolling off every year. In order for us to get to that, we're going to stagger the first terms for fall 2023. So some of you or some interested parties who are nominated to these committees will get a 3-year term, a 2-year term, and a 1-year term. Moving forward from there, it would all be 3 years after that point. And then for co-chairs, there is a 3-year term limit there with the option of renewing for one time for a 2-year extension. Next slide, please. So again, the nominations period, it opens today. It's open for 30 days, that's 30 calendar days. Someone can nominate themselves, or if another individual wants to nominate someone, they can do so. Now for E&M, or endorsement and maintenance, that is individual nominees, so not organizational nominees. So you can't nominate your organization. You can do this for primer and MSR, or you can do individual for primer and MSR, but for endorsement and maintenance only, it is individual representation. So we're not bringing on organization seats, as you saw based on our roster categories. Nominees will commit to all scheduled calls, meeting dates, and provide timely responses to any requests or feedback, and being available for ad hoc meetings as we go through the process. Next slide. Eligibility. So in order to be eligible to be considered for an endorsement maintenance committee, you must be a PQM member, or the Partnership for Quality Measurement member. Membership is free. So as Nicole had mentioned early on, we really want to try to increase the visibility of this work and really bring in all interested party perspectives to become PQM members. Signing up to become a member allows you to get announcements about events, opportunities for public comment, other opportunities for nominations, anything else that's going on within PQM, both with endorsement and maintenance or the primer work. Signing up to become a member is free, and you can obviously keep up to date with what's happening within the CBE. You also need to provide an application, which includes providing your CV or a letter of intent or interest, as well as a disclosure of interest, right? So just to disclose any potential conflicts that we need to consider. We also will be looking to seat people based on the relevant experience needed for that given project, as well as any experience related to the use of quality and efficiency measures. And the nominee or nominees should associate with at least one of those roster categories that we mentioned previously, and you can see them again listed on this slide. Next slide, please. Okay, so now we're going to go through a walkthrough of the process itself. So you saw this figure previously in the earlier section that Brendan was talking about, but really there's 6 major steps through this process. You have intent to submit, as well as the full measure submission, and the subsequent slides after this will go into more detail. You also have staff internal review that is concurrent with the first public comment opportunity for measures. So this first public comment, or submitting comments about the measures that have been posted for endorsement review, and those comments will be brought to the committee for consideration within their review of the measures and providing an endorsement decision. We also then have the E&M committee independent review. So that is that independent review for the entire committee, both the advisory group and recommendations group. They're doing this independently and using the same rubric, the same measure evaluation rubric that staff have used to create their assessments of the measures. And using that same rubric, we will then identify areas where there's not consensus on it in aggregation, right? And then we convene for an endorsement meeting, and we're convening the recommendations group to do a lot of the discussion through facilitated discussion. And then at the end, we bring back everyone, including the advisory group members who are listening into those discussions to make a final vote of endorsement. After that, the appeals period starts, which kicks off that second public comment period, which is really the appeals period, in which any interested party can submit an appeal for any endorsement decision, whereas previously it was only for measures that were recommended for endorsement. This new process, the appeals period, is for any endorsement decision, whether endorsement is a measure is not endorsed or if a measure is endorsed. You are able to submit an appeal, and we'll touch on that here in a little bit as well. Next slide, please. So the intent to submit, this is the first step. So this is where you submit key measure information. And previously, developers had to submit the full specifications and testing for the intent to submit timeframe. And that was about a 3-month timeframe in which there were some reviews of the testing approaches, et cetera, even convening the S&P, or the scientific methods panel, for complex measures. Rather, the intent to submit for this new process will just be high-level information about the measure title, the measure type, the description, the numerator, denominator, et cetera. So very high-level basic information. And really that information is used for internal planning to determine which committee the measure should be evaluated within, as well as the number of measures that have been submitted, and trying to plan accordingly internally to make sure that we have the adequate expertise available for these committees to evaluate the measure. So the timing for that intent to submit is October 1st and April 1st. So fall, in the fall 2023 cycle that will be kicking off this new process, that intent to submit timeline is October 1st, whereas the spring, which will be next year, that kicks off April 1st. Now, where can you submit your intent to submit? You can do so through the PQM website. Now, we are currently developing a submission tool, a submission and repository tool, which will allow developers to submit, review, and update their measures for endorsement consideration. This STAR tool will be available for developers during the full measure submission deadline in November for the fall 2023 cycle. But for the intent to submit that will be coming up for this October 1st timeframe, we will be using the PQM website to submit that intent to submit. So it wouldn't be STAR, but STAR will be available during the full measure submission, which will happen a month after October 1st by November 1st. So the webinar, we also will be having another informational session or webinar later on, probably sometime in September, to provide an overview of submitting a measure via the STAR or submitting a measure to Battelle. Again, you can find more information about this on the PQM website, as well as the E&M guidebook, which is open for public comment on June 30th, which is today. Next slide, please. So for the full measure submission step, as I mentioned, it's a month after intent to submit. So for fall 2023, that will be November 1st, and you will be able to use the STAR to submit your measure information, and that is everything. The evidence, testing, other aspects that is needed for the measure based on the rubric that is also provided within the E&M guidebook. Where to find that information again, you can find it on the PQM website or the E&M guidebook itself. And that STAR system is an online tool that developers will be able to use to submit all that information. Next slide. So the next step here is internal review, and this is staff internal review. So once the full measure submission happens, we do a completeness check to make sure that there aren't any missing fields or missing responses to questions that are truly needed in order for the measure to be evaluated. And then right after that, we go into staff assessments. So these were formerly preliminary analyses at the National Quality Forum, if that term is familiar to folks on the call. Very same type of approach here is to really look at the measures and bring forward any salient points or any issues that the standing committee should be aware of in their consideration of the measure. So the staff assessments will still use the same rubric that the the E&M committees will be using as well. And there are 5 domains of that rubric. And this rubric is also included in the E&M guidebook, which again is posted on the website for public comment. Those domains include importance for the measure, feasibility of the measure, scientific acceptability, which includes reliability and validity. There is a domain of equity as well as use and usability. Now, for the equity domain, if those have submitted measures to NQF and familiar with the disparities section of the performance gap criterion, this is very similar, in which we're looking to see how the measure contributes to efforts to address inequities in healthcare, by providing a description of any methods used to look at testing across different populations and subpopulations, and those really thinking about those with socio-contextual variables as well. So where you live, education levels, income, very interested in seeing some of that information come through. The timing for this, with the completeness check and the staff assessments being constructed, is about 4 to 5 weeks. And the output of that is really staff assessments themselves and ratings, some preliminary ratings on the submitted measures. And those staff assessments, before they go to the committee for their independent review, we will provide them back to the developers and stewards for a factual review, just to make sure that we captured the information accurately and correctly if we're trying to summarize the results of testing, for example. So there will be time for the developers and stewards to have a factual review of those staff assessments before they go to the committees. Next slide. So this also launches the first public comment period. So this happens concurrently once the full measure submission is submitted. So the measure information is then posted to the PQM website. So all the measured specifications and additional types of testing attachments, all of that will be provided on the PQM website for a 30-day commenting period. The outputs of this will be a full record of the public comment available on the PQM website. And if anyone has been looking at the fall 2022 and spring 2023 cycles, you can see that the comments are fully listed and transparent on the PQM website for either a measure or even for a meeting summary that happened for the fall 2022 cycle. And then we also provide a summary of those public comments during the endorsement meetings themselves, again, to continue to draw attention to the voice of the public and all interested parties within this work. Next slide. So for the endorsement committee review, so this is an independent review of those measures. So these are looking at the staff assessments, which have their preliminary assessments and ratings. And again, they use the same rubric that staff use for their staff assessments. And there's an aggregation that will occur to determine the areas of non-consensus. So as the independent reviews are happening, they're actually looking to see, has this criterion been met or has it not been met? And going on to the next criterion or domain, has this been met or not met? That type of scoring is something that we will look at in aggregate to determine where there's non-consensus on aspects of the measure. And that is what we will bring forward for discussion at the endorsement meeting. So for timing for this, we give committee members 3 weeks prior to the E&M endorsement meeting to do their independent reviews of the staff assessments. And these will also be something that we're looking to house online, these independent reviews being housed online, and that also allows us to do some quick aggregation of results. Next slide, please. So this sort of talks a little bit more about that novel hybrid Delphi and nominal groups process. Remember that the Delphi group here is the advisory group, whereas that nominal group is the recommendations group. So starting with the left figure here, I know this is kind of a busy slide. So as we mentioned, we have this E&M committee at the very top, right? And we break them down into 2 subgroups, recommendations group and advisory group. So during that independent review, and you see that first arrow from the previous slide that we just talked about, that does happen before the endorsement meeting, and it's an independent review and both groups do their independent reviews. Then those reviews are aggregated to identify areas of non-consensus or lack of consensus that we will then bring forward as we go down to the endorsement meeting and convening the recommendations group to review and discuss those areas of non-consensus, in addition to consideration of public comments. After those discussions are over, we will then reconvene the entire committee, advisory group, and recommendations group to do a final endorsement vote. So the vote that happens, again, is only on the endorsement decision. Currently, we're not voting on all the different domains of the rubric that was used to evaluate the measures. Rather, we're discussing areas of non-consensus based on that evaluation, and then after which we will have a final endorsement vote at the end of the call. That endorsement vote is then published and a meeting summary is produced for consideration, and then we move over into the appeals period. But before we go there, if we go to the next slide, I'll just note that how are we determining consensus? So when you think about consensus, that's really just trying to identify agreement. And variance is used as a metric to assess disagreement or a lack of consensus. So the more variation that exists, the more there is disagreement. So this really leverages some inter-rater reliability statistics to form this consensus measure, and it really allows for the assessment and degree of disagreement in committee votes. So this approach is really advantageous because it takes into consideration the different sizes of the groups that are voting and the different rating options available to them. And based on this approach, consensus is determined to be 75% or greater in agreement among members, or 75% or higher agreement among members. So previously, the prior NQF process was greater than 66%. Here, this is 75 or higher. And how did we get here? If you go to the next slide, this is really rooted in evidence. And this table is really busy, so just bear with me as we go across this table. At the top row, you can see the number of respondents. So this will be representative of the number of committee members responding to these options. The options here could be evidence is complete and adequate, right? So that criterion is met. Or the evidence is not complete and it's not adequate, but it may be addressable if the developer did something else, right? And then there's the third category, which is the evidence is not complete, it's not met, and it's really not addressable. So this measure of consensus here is really an index on the far right column, right? So an index of 1 is really high agreement, right? We are very, very confident here that based on where the votes landed, that there's true agreement going on with the voting. And as you can see, we have 95. So you see that measure of consensus. We have about 95% to almost 100 type of assurance of confidence that when we have a consensus of 75 or higher, we are very confident that there's true agreement going on, and that would be where it's landing across one of these options. And again, this technique takes into account the number of respondents voting on the measures. So it could be 40, it could be 20, it could be 10, it could be 50. So it really is very flexible in that way, and really looking at 75 being the measure of consensus that we're looking for. Next slide, please. So that is done in advance of this meeting, right? So when we have those independent evaluations, right, and we look to see how all those evaluations looked in aggregate, we're looking to see where there's 75% agreement across any of those options, whether the criterion has been met, it's not met but addressable, or it's not met at all. And we bring those for discussion. Now there are quorum thresholds that we have to keep in mind as well. So for meeting quorum, that's where we want the recommendations group to meet and discuss the measures. We're only looking at the recommendations group at that point, but meeting quorum should be 60% or greater of the active committee members or active recommendations group members that should be on the call. Now for voting, since voting is happening with the advisory group and the recommendations group, the voting threshold and quorum threshold there should be 80% of the active members. So coming back at the end of the meeting to vote and provide a final endorsement decision, we need to ensure that we have 80% of the active members on the call to vote. So timing for these endorsement meetings for the fall, you're looking around January, February, and for the spring, you're looking at July, August timeframes. And the outputs from these discussions and the voting will obviously be the endorsement decision. Next slide, please. So what are the endorsement decision options? So you can see there are 4 listed here. A measure can be endorsed. This applies to new or maintenance measures. Again, there's a 75% agreement for that endorsement from that committee. And this will mean that the measure comes back about every 3 years for maintenance review, unless there's some sort of off-cycle or emergency review that needs to happen. Measures can be endorsed with conditions. Right? So this applies to new and maintenance measures as well. And again, this is where 75% or greater agreement needs to happen in order to determine endorsed with conditions. And these conditions are recommendations that the committee provides. And if they are not addressed by the next time the measure comes back through and there's no rationale provided, then the committee may choose to remove endorsement if the recommendations or conditions are not met. This also may come at a different timeline for maintenance review. So based on the condition, there may be a recommendation to try to bring the measure back within a 1 or 2 year time frame, as opposed to 3 years, depending on the condition. Now, there's also not endorsed. And so that really only applies to new measures. Since a maintenance measure already has endorsement, an endorsement would be removed for a maintenance measure, but for new measures, it's just not endorsed. And again, you have to have 75% or greater agreement to not endorse the measure for that decision category. And then also for endorsement removed, again, 75% or greater agreement to remove the endorsement of the measure. And a measure steward can also retire a measure, and that would also mean that the endorsement has been removed, or the measure steward never submits it for maintenance and there's been targeted outreach to try to reach out to the developer about their intent to continue on with maintenance. And if that's not the case, we may decide to remove endorsement of that measure. In addition, there may be some other aspects of it, including like a gap. So if the gap has plateaued or the gap has become very minimal, there could be also a decision here to remove endorsement for a maintenance measure. Next slide. So coming back to this and getting to these endorsement decisions and how do we get there? So again, we're still looking at 75% because based on evidence, we know that at 75%, based on the number of individuals voting, we have strong confidence. That means true agreement, true consensus. So in order to be endorsed, you have to have 75% or more landing on endorsement to choose to endorse the measure. Now you could have endorsement with conditions as well if you had 75% or more landing right in the middle. But if you also have something that's merged between the two, where you have an endorse, and some members also say endorsed with conditions, but totaling those two votes, it's 75% or more. We would then default to a B, which is endorsed with conditions, because there are some members that really still feel strongly that there should be some conditional things that need to be addressed in order for the measure to be fully endorsed without any conditions. Lastly, if the members land on do not endorse, 75% or more of those votes land there, obviously the measure is not endorsed. And the other alternatives that you see below, which is 26% to 74% for any of these other categories, means no consensus. And that's an important finding, because even after these facilitated discussions, there's still no consensus that can be achieved excuse me, on the measure. And so if no consensus is achieved, then the measure does not get endorsed, right? So through those facilitated discussions of those areas of non-agreement on any particular area of the measure, through those discussions, we hope to drive to consensus, but there still may be no consensus achieved at the very end of this. And if that's the case, the measure is not endorsed. Next slide. So I mentioned the appeals period. So that's going to happen, kicks off right after the endorsement decision is rendered, and we post the voting results and the endorsement decisions. It kicks off the appeals period. And that is for 3 weeks. So it has a 3-week appeals period. And this is where, again, there's a public comment opportunity for any interested party to submit a comment or excuse me, an appeal request for any endorsement decision. And you can do so through the PQM website. And the outputs of this are really a full record of any public comment available on the website. So as you can see, it will be published on the website, and a review and consideration of that appeal request. So just by submitting appeal doesn't automatically mean that an appeals committee will be convened. There are criteria to establish whether or not the appeal is eligible to be reviewed by the appeals committee. And we're going to get into that next. So next slide, please. So I mentioned any interested party can submit an appeal. There will be an ad hoc appeals committee that's convened based on the eligibility of that appeal. And that eligibility is determined internally by Battelle staff based on a set of criteria. The timing for this will be around February, March timeframe for the fall, in the August, September timeframe for the spring. But again, you can see that in the previous timeline figures in this slide deck, but also in the E&M guidebook. The outputs of this will really be is the eligibility decision, meaning was the appeal even eligible to be brought forward or not? And if it is eligible, there'll be appeals committee decision if they are convened. Next slide, please. So here's sort of a process flow for that, right? So you can see the appeal being requested. It's submitted via the PQM website or the Partnership for Quality Measurement website, citing evidence-based concerns or inapplication of the criteria. There's then that preliminary review by the endorsement maintenance team or Battelle staff to determine whether or not the appeal is eligible based on those criteria. If it is, it would then be brought to the appeals committee. And the appeals committee consists of all of the E&M co-chairs, the endorsement maintenance co-chairs. That's all across all 5 projects. So there's 2 co-chairs per project. So that would be a 10-person committee, plus Battelle staff that are related or have worked on that project in which an appeal was submitted. And also we have the ability to bring in, again, any subject matter experts needed to provide more context or relevance to the issue. So if the appeals committee is convened, they will determine whether appeal should be accepted or not, and that final decision will also be posted. Next slide, please. So I mentioned there's you can do it on any endorsement decision. So for endorsed measures, in the case that the measure is endorsed, the appellant or the interested party submitting an appeal must cite evidence that the appellant's interests are directly and materially affected by the measure, and that the consensus-based entity's endorsement of the measure has had or will have an adverse effect on those interests. And you can cite the existence of a procedural error or information that was not available by the cycle's intent to submit deadline, but was not considered by the E&M committee at the time of endorsement decision. So both of those need to be, both those criteria need to be met in order for that appeal to be eligible. So again, if there's new information that was available by the cycle's intent to submit deadline and was not considered by the E&M committee, then that could potentially constitute an appeal. And that new evidence would mean that it would change the endorsement decision. So for example, if there's evidence that was available prior to the intent to submit deadline for that given cycle, or pointed to adverse effects or harm related to the use of the measure, that is something that potentially we would want to consider here for an appeal. Next slide, please. So for measures not endorsed, in the case of endorsement being removed or measure just not endorsed, consensus-based entities measure evaluation criteria were not applied appropriately. So the appellant must cite that case that it was not applied appropriately. And this rationale, the appellant must specify the evaluation criteria or that rubric domain they believe was misapplied. Or the consensus-based entity process was not followed. So the appellant here must also specify the step of the process or how it was not followed properly. And that also can be eligible for the appeal to move forward. Next slide, please. So the final endorsement decision being posted. So if no appeal, the original endorsement decision remains. If the appeal is eligible, the decision of the appeal would be posted. The timing for this would be within 2 business days after the appeal decision is rendered. And for the outputs on this, it's just the final endorsement decision and updates to the STAR. So that's that measure repository, which again is also where developers can submit their measures, but it'll also be a searchable database on the website for any interested party to see any information about the measures. And also the outputs of this is a final technical report. So every project will have a final technical report. So if you're convening 5 projects in a cycle, there'll be 5 technical reports of that project, which will summarize the list of measures that were submitted, the endorsement decisions, the comments that were submitted, as well as any other summary and scope of the process. Next slide, please. Okay, so that concludes our walkthrough of the process, as well as committee structure, and a little bit more about the changes that we're implementing. Again, these changes will kick off for the fall 2023 cycle. So that will be October 1st is the intent to submit deadline. If you're a developer and interested on looking to see when you can do that intent to submit, we're looking to launch that on the PQM website in September. And we're also looking to have another informational webinar on this process around that same timeframe. But we want to give it time now to answer any questions that have come in. I think there was quite a few coming in. And again, if we don't get to all of these questions, we will be providing an FAQ in our responses in the weeks ahead. In addition, obviously, there's the public commenting that's happening or kicking off right now in the guidebook. We also will be providing responses to those public comments that we do receive. And we really encourage you to submit those because even though we're talking to you about this process now, we do want to continue to refine, clarify, or potentially provide additional modifications to the process if needed. So please take a look at that guidebook and submit your comments by the allotted time. Lastly, and before I give it back to Brenna, this meeting is being recorded. We will post this presentation as well as the slides to the PQM website sometime in the next week. So please keep that in mind. And of course, that FAQ would be sometime possibly later. Okay, Brenna, should we dive in?
Yes, and we have a ton of questions to work through, so bear with us as we get organized around these. I will note that some of the questions that have come through, the team is responding to them in real time via the Q&A feature. There are a handful of questions that I've already noticed that are excellent, but because they are excellent, they may require a little bit more time for us to think through. So those are things that we'll respond with at a later date via an FAQ document. So if you don't see a response to your question, and you don't hear us talk about it today, it doesn't mean we've ignored you. It just might be down the line, but there are quite a few that we'll get through today during the live Q&A. So I'll get started here. The first one, Nicole, I think this one is maybe a good one for you. Can you talk about how we're going to be reaching out to traditionally underrepresented groups that don't traditionally provide feedback to this process? So not just demographic groups, but patients in general and the members of the public for whom these measures impact.
Yeah, absolutely. This is a big priority for us. So we have a couple of partners on the Institute for Healthcare Improvement, so that's IHI and Rainmakers. They are both working with us actively right now to put together communication plans and reach out to those groups. We are also trying to reach out to patient advocacy organizations, as well as other clinician associations to let them know that this process is here, that it is available for them, and that we are trying to make it as low burden as possible. We are doing lots of individual meetings and webinars with anybody who's interested in having us present to their association or to their advocacy group so that we can explain the process and educate on what and how everyone can be engaged. We are certainly taking additional recommendations on how we can get the word out, so please feel free to let us know how you think we can do a better job in accessing these populations and letting people know that their voice does have meaning here and that it is powerful to participate in these groups. Thank you.
Thanks, Nicole. The next question that came through, it was related to the scientific methods panel. We were asked, will the SMP members from NQF be retained for the Partnership for Quality Measurement? I can take that while Matt is getting his bearings. The short answer is yes. We have already done some outreach to existing scientific methods panel members to seek their input on what they might like their role to be under the PQM. We certainly don't want to lose any of the expertise or experience from members of that group, whether they want to continue participating in the SMP itself or in other aspects of the E&M process. So yeah, so the short answer is yes, those folks will be retained, but the, I suppose, longer answer is that it's really up to them. The next question is, what strategies do you anticipate using to increase public comments besides sending info out to listservs? The comment added that previous efforts have had variable response. Sometimes no comments are received. Do we have any ideas for encouraging more responses? I think that Nicole's response and how we're going to reach difficult or maybe less sort of traditional CBE stakeholders touches on this a little bit, but I would just add that we do plan on doing some targeted outreach to specialty societies, professional organizations, and patient advocacy groups as needed to increase awareness of the public comment periods. And when I say as needed, I mean that if we know that measures are coming up for comment that directly impact a certain specialty group or patient group, then we'll want to make sure that we do targeted outreach to those folks so that they know that there's an opportunity to comment on something that will directly impact their stakeholders. But as Nicole said, we are more than open to suggestions on how we can more effectively or more extensively increase public engagement. So please do feel free to let us know if you have any additional thoughts on that. Okay. Matt, this next one is going to be for you. The question was, do you have a list of the streamlined standing committees? So I know you went through that on the slides. Either you can show that slide again, or if you want to just speak to it verbally.
Yeah, sure. If we could click back, I believe it's slide 23. Yes, there's 5 of these project committees, and we're kind of clicking back a few slides here. So originally, the prior process had 14. You see those listed there. That's not including the SMP, CSAC, or Appeals Board. We are now streamlining that to 5. And as mentioned earlier, it's not a 1-to-1 mapping. It's not a 2-to-1 mapping or even a 5-to-1 mapping here. It's really looking at the patient journey. So starting from primary prevention, so prevention of disease, to the initial recognition and management of a disease, to then moving into that management of an acute events or chronic disease, including things like surgery and behavioral health, and ultimately ending at the end of life, where you have like more end stage diseases, terminal illnesses, et cetera, within this category. We also have cost and efficiency because those measures are very unique in and of themselves and are also very cross-cutting. But we will have a cost and efficiency committee or project that will view all those cost measures, which look at healthcare spending based on a time frame or based on an individual accountable entity. Or a service that's being provided, for example, So those measures would still be included in this cost and efficiency committee.
Thanks, Matt. And I'm actually going to jump ahead one question because it's relevant to this slide, so we might as well just keep it up there. One participant said that they believed they had heard that renal measures will go under the end of life committee and asked whether or not that's correct and why those measures wouldn't fall under the chronic conditions group. So we talked about this a little bit on the side while you guys were talking, and I would say that many measures related to chronic renal disease would probably be assigned to the chronic conditions committee, but any measures related to end-stage renal disease would probably be assigned to what's listed here as end-of-life care, but is probably more aptly named the advanced illness committee. So I think the short answer is that it's not that all renal measures are going to be in any one category. As with any condition, it's really going to be based on the sort of phase of the patient journey that's covered by a given measure within that topic area. Okay, back to the queue. So this one again is for you, Matt. What is the process for identifying and selecting subject matter experts for ad hoc participation? Will they be assigned to specific committees or just specific relevant measures under review?
Yeah, great question. So the process could be where we have measures or a measure that may be submitted to a particular project that we may be lacking some expertise to evaluate that, even though it somewhat fits within that project. We would first look across other committees to see if we have other expertise that we could bring over to be a subject matter expert to provide more context and relevance to the discussions for that committee, or we go to our PQN membership as well and look to see where there are potential experts in a given area that would be better suited to, again, provide more context and relevance to the discussions that will be had by that specific committee. So it's really looking at across the committees that we already have pulled together for that expertise, but also looking at a PQN membership if needed to really bring forward that expertise. That could be for evidence discussions. It could be for considering, maybe even considering validity type of testing and thinking about the most appropriate type of correlation to a certain outcome, or even thinking about the risk adjustment types of variables included in the model. It could be any one of those things or more. But that's where we would, again, if we don't have that expertise currently based on any of those roster categories and across the 60 people that we're convening, we would then look to the other committees that we have established, any one of these 5, as well as the PQN membership for that expertise.
Thanks, Matt. We did get a whole bunch of questions related to the measure developer's role in the endorsement process. So I'm going to try to consolidate a couple of them here. So first, folks are wondering if the areas of non-consensus that are identified after the preliminary reviews from the advisory and recommendation groups, are those going to be provided to the measure developer prior to the endorsement meeting? And then as a tack on to that, what role will the measure developers have during the endorsement and maintenance committee meetings, if at all?
Great question. Yeah, I think I was scrolling through some questions here. So I'll maybe touch on that, and maybe another question I saw around developers and submission to Patel. So developers obviously have a very important role in this process, not just to develop the measures and submit them, but also to be aware of any public comments that have come through, as well as any committee concerns. And so as I mentioned before, all the comments for any given measure up for endorsement review are going to be posted on the PQN website to the respective measure. And those will be fully visible to any interested party. So developers will be informed of those comments, and developers are more than welcome to review those comments in advance of the meeting as well. And they also have the opportunity to do a factual review of staff assessments. So those, again, were formerly called preliminary analyses, for those that may be familiar with that term and what type of information is provided in those preliminary analyses. It's really any high-level information about the measure, any important considerations that the committee should think through or pay attention to is provided in these staff assessments. Developers will have an opportunity to do a factual review of those staff assessments before they go to the committee for an independent review. In addition, after the committee has done their independent reviews and those reviews are aggregated to determine where there is non-consensus on any domain of the rubric, of the criteria rubric, that will also be shared back with developers and any other interested party, part of the meeting materials that we'll be sharing. So that will be shared in advance of the meeting, right? So developers will also have access to that. Developers are also invited to attend the meetings, to listen into the discussions that do happen. There will be opportunity to provide an overview of the measure. And again, if there's any specific types of questions that do come up in which the developer is needed to address, there may be an opportunity for that as well. And then obviously there's the appeal process. So developers in the prior process could submit an appeal. And as we mentioned through this presentation, any interested party can submit an appeal. So that includes developers. So if there was concern about a process not being followed or in application of criteria, if the measure is not endorsed, for example, developers have the opportunity to submit an appeal. And you can do so within that 3-week time frame, like we mentioned. So I think I covered all of that you mentioned, Brenna. I also saw a question about deferring measures. So yes, there will be the ability for developers to defer or request to move their measure to another cycle. Now, really strongly encourage developers, stewards to look at the E&M guidebook that's posted right now for public comment and submit your comments. Really encouraging those who know that they're coming, who know they have measures coming back through for the fall 2023 cycle. We will be working closely with developers, not just for maintenance measures, but any developer on readiness for that fall 2023 cycle, and work closely with you to see if you are not ready, if there's an opportunity to move that measure to the next cycle or potentially a little bit further down the process, depending on how old the measure is, meaning when the last time it was endorsed or any priority considerations we need to think about, right? Like if it's used in a program, things like that. So there will be an opportunity to work with Battelle, especially for the fall 2023 cycle, on your readiness to submit for that cycle, based on your review of the rubric, based on your review of the process. So we'll be reaching out to developers here in the next couple months, both developers that we know have maintenance measures slated for fall 2023, working with those developers to determine which measures can be moved to a subsequent cycle, and other readiness from developers on submitting a measure to Battelle. And that's not just for maintenance measures or measures that are endorsed currently, but also for developers of new measures. So we will be sending out blasts with our listservs to all developers. And so just in case those developers also have new measures that we're intending to submit for fall 2023. So we will be flexible to the extent possible, recognizing that this is a new process. The rubric, as you look at it, the elements of that rubric are not very different than what you have seen previously with the NQF criteria. How we're now looking at this is whether or not that domain of the rubric, whether it be importance or whether it be feasibility, has been achieved, has been met, or has it not been met, or has it been met or not met, but is addressable. So that's where we're trying to aggregate those scores, right? So we want to make sure that developers take a look at that. And really, we're going to be flexible as possible to ensure that you are ready to submit your measure to this new process. So like I said, we'll be reaching out in the coming months about this. And again, we also have another informational or educational webinar that will be happening sometime in the September, maybe timeframe, maybe a little bit later than September, around submitting measures to Battelle. And so what that would mean with the intent to submit, as well as the full measure submission itself.
Thanks, Matt. This one I hope is a quick and easy one to answer. So we have someone asking about the Prevention and Population Health Standing Committee, the carryover committee that meets on August 1st. Can you explain where this committee fits into the structure that we're describing?
Yeah, all of the NQF committees that you see listed here and all of the expertise that has been involved over the years, we definitely very much appreciate and very much recognize the commitment and again, the expertise insights that have been shared within those committees. These committees will be retired, right? After we conclude the spring 2023 cycle, which is the last cycle that was kicked off at NQF before the contract transitioned. We will be retiring these committees and again, moving to this 5 committee structure. However, we strongly encourage those members that are currently serving on those committees to nominate themselves or draw attention to other aspects of our work that they're interested in getting involved in. That includes primer and the MSR process, because we recognize the great work that you've all done, and we really want to continue to have you engaged. And even outside of the nominations process, if you feel that you are not wanting to continue on a committee, we still encourage you to become a PQN member. And you at least get announcements, further opportunities that may be of interest to you, including opportunities to serve on other committees or panels, such as the scientific methods panel or any other advisory committees that we may find necessary as the process moves forward. So please become a PQN member. That allows you to get those announcements. And again, if you're interested to continue serving in this work, the nominations period is open right now, and it closes after 30 days. It just opened today. So please submit a nomination for yourself or someone else to serve on one of these committees. And please reference your expertise and time that you've provided to the prior CBE process as well. So one of the other elements that we're looking at for eligibility is just familiarity with quality measurement and efficiency measures. So there is familiarity with these committee members that have served on these NQF committees. So that will be something we also take into consideration.
Thanks, Matt. And you may have said this, and if I missed it, I apologize, but do you want to just also reference why folks might see announcements about committee meetings from the spring 2023 cycle?
I apologize if that, apologize if I missed that, Brenna. So for the fall 2022 and spring 2023 cycles, if you've seen announcements about this, or you've seen calendar invites about this, or any communications, these two cycles were started at NQF, and when the contract transitioned, they were not concluded. So we are closing out those cycles. So the fall 2022 and spring 2023 cycles will be closed out this year, and they will follow the same protocols that they did at NQF. So there will be a post-comment meeting, there will be a CSAC meeting, and you see some of those calendar invites and meeting events are on the website as well, or you may have received them if you're currently serving member or developer have measures for this given cycle. So those committees would still be functioning to close out the fall 2022 and spring 2023 cycle. And I think I speak for all of the E&M team and the CBE staff to really say thank you to those committee members for your continued interest and your continued support in this work, recognizing that these cycles we're trying to conclude, but also your interest in continuing on and serving in this work within the 5 new committees or other opportunities as we move through the process. So just thank you very much for your patience through this transition and kind of thinking about what's next. We've been on a lot of calls with individuals wanting to know what's going to happen. We've been trying to give them pause to say, wait till June 30th to this webinar. And so we want to thank you very much for your patience through all of that, and really hope that you continue serving on this committee and submit a nomination to continue to serve.
Thanks, Matt. That's great. We have a couple additional questions related to committee composition and recruitment for those. I'll take a kind of a first stab, but Matt, I'll turn it to you if there's anything you want to add. So the first is somebody asking, what is different in committee composition from the prior makeup? And then a follow-on is whether priority will be given to those who are currently serving on standing committees. And so I'll start by saying that the sort of overarching group of individuals, the roster of different perspectives that we're trying to recruit for these committees should look relatively familiar, right? We're looking for a representative balance of stakeholders similar to what NQF was trying to do. So making sure we have a good balance of patients, caregivers, patient advocates, clinicians from different settings, purchasers, hospital representatives, EHR vendor representatives, and then of course people that work or experience any of those perspectives in a low resource setting, in a rural setting, and so on. So that breakdown is not dramatically different. The real difference is how those perspectives are distributed across the groups. as Matt described. Matt, do you want to talk a little bit about whether or not priority will be given to current standing committee members?
Yeah, sure. And if we could go, I think maybe one more slide. There we go. So the eligibility here. So we definitely recognize that the former committee members have a lot of experience with this work, and we will be looking to bring in those who have had experience related to quality and efficiency measures. So that includes those evaluation committees that were formerly at NQF. So I wouldn't necessarily say there's a priority to those, but it is part of what we want to look for when we're trying to seat 60 people. And so that's a large number. Again, based on those roster categories, and you see the counts or the seats we have allocated there, we really want to also ensure that in addition to those expertise that we're getting across those roster categories, we do have experience with quality measure, either development or evaluation, even efficiency measures, with cost and efficiency measures. So there will be part of a look at this as part of our criteria, but depending on where there are potential gaps that remain, depending on if we, again, want to ensure that we have enough of the patient voice seated on these committees, we can't fully say that we're giving priority to those former standing committee members, but it is still something we're really focusing on to ensure that we have familiarity with evaluating quality measures or developing quality measures within this process.
Thanks, Matt. Okay, this next one is going to be for Nicole. Nicole, if an organization applied to be a member, so an organizational member, can that organization nominate someone on behalf of that organization, or would that individual have to become an individual member to do so?
Fantastic question. We are accepting organizational members for the pre-rulemaking measure review, so the primer process. Organizations can be on a committee and they can nominate someone to represent their organization in that process. For endorsement and maintenance, we are asking that individuals participate on those committees rather than having organizational seats for E&M. So again, organizations can participate in primer, but individuals are asked to staff the committees for E&M.
Thanks, Nicole. And just as I'm rereading the question, I suppose the add-on there is that it's completely fine for an organization to nominate someone within their organization to serve on the committee. It would just be that person would be representing themselves as opposed to an organizational seat. All right, that was another developer question that I think Matt addressed already. So I'm going to skip ahead. Matt, do you want to just talk about, I think we mentioned during the call that the meetings will be virtual. Can you just talk a little bit about how long each of those meetings will be and any other detail that you can provide about format?
Sure. Yes, the meetings will all be virtual, most likely on this Zoom platform, similar to the Zoom webinar platform. They may be all-day meetings, depending on the number of measures that are submitted to the committee for consideration. There was a question around the cap of measures as well. We will be looking about 9 to 11 measures per committee per cycle, right? So that's 5 committees. Each one could be capped at 9 to 11 measures, and there's 2 cycles a year, fall and spring. So you can kind of do the math on that one. So there is a cap. But that's where we'll be looking to work with developers on potentially moving measures to a different cycle. We also have opportunities for ad hoc off-cycle reviews as well. So that's where there may be an update to a measure that's a material change that needs to have that measure be brought back off-cycle. Or potentially there's something that's been submitted by an interested party that draws attention to unintended consequences with the measure that would require us to also bring the measure in back off cycle. And then there's more information about that in the E&M guidebook. And Brenna, as I was talking about that, I think I forgot the first part that you had originally asked.
The original part of
the first part of it. Sorry?
It was just how long the virtual meetings will be.
Oh, Yeah, I mentioned all day. So the structure of those, right? So obviously there's attendance that we'll have to do, disclosures of interest, types of considerations, as well as getting into the actual facilitated discussions of the measures. And again, we're not voting on every domain based on the evaluation rubric. So we're not voting on importance and then feasibility. Even if there are through the independent reviews where we see that there's non-consensus, let's say on feasibility, we're discussing feasibility because there's non-consensus on that through those independent reviews, but we're not voting on feasibility. Rather, we're discussing it through the facilitated discussion. And also at the very end of the call, we then vote just on the endorsement decision. So I mentioned also that developers are encouraged to attend those calls because we have the opportunity for them to provide any opening remarks to the measure. Again, this is going back to what I mentioned about reviewing public comments in advance of the measure or any committee concerns on areas of non-consensus to make their case before the committee opens up for discussion on that issue. I hope that provides a little bit of answer to your question.
Yep. Thanks, Matt. All right, we're going back really quickly to committee membership. Can you, Matt, talk about whether or not terms for committee members can be renewed, or is there a required hiatus period between terms of appointment? So do they need to take a year before they can reapply to be on a committee?
Yeah, we're looking at that where it's taking there's a hiatus between terms. Again, these are 3-year terms, except for the co-chairs. Again, this is we want to ensure that we get a lot of rotating perspectives through this, but also ensuring that there's continuity in the process by having folks that are on for 3 years. So we'll continue to look to work with those term limits. Again, the first nomination period, this first fall 2023, these first committees will have different term lengths. So folks will be randomly assigned to either a 1-year, 2-year, or 3-year term for this initial nominations process. The reason being is because as we open up nominations year over year after that, there's overlap and a staggering of the expertise that has been involved in that committee, and then also bringing in the new committee members through that nominations process. So the 3, 1, and 2-year type of approach for the fall 2023 nominations period allows us to get into that type of staggering moving forward.
Thanks, Matt. So a more recent comment came in, but it's relevant to this and to some of the comments we were just addressing. So I'll bring it up here and Matt, chime in if there's anything you'd add. But someone mentions, with the requirement for individuals only to be on endorsement and maintenance with such broad scopes, how are we going to ensure that there's adequate representation of each topic? So surgeons, for example, would be very different from behavioral health providers. And so I'll start by saying we agree completely and absolutely recognize that there's going to be instances where we need more robust representation from a specific specialty group, depending on the mix of measures that come through in a given cycle. So Matt, I think, talked fairly extensively earlier about how we're that doesn't mean that we don't have plans to engage specialty societies or professional organizations throughout this work. So we do have every intention of cultivating those relationships and tapping into those networks as needed to make sure that we get the representatives that we need on a given committee so that measures get their due. But Matt, anything you'd add there?
Yeah, that's exactly it. And we would do this after that intent to submit deadline, right? So if you're on the call earlier, the intent to submit, again, is not going to be where developers submit all the testing that they've done for the measure or even the full specifications. It really is a high level description of the measure. So brief description: what's your numerator, what's your denominator, what's your level of analysis, what is your measure type, right? So that basic information allows us to do some planning internally, both to see what committee it really should fit in, but also, do we have the expertise needed on that committee, and where can we go to bring in that expertise if needed? So that expertise could be across the other 4 projects, if you're looking at just, if we're focusing on one, it could be across those other 4 projects like we've mentioned previously before, or it could be within our PQM membership. So if there is expertise that is not on this committee, but the measure focus really aligns with that committee, we will ensure that we look across other committees for that subject matter expertise to be involved in the discussions of that measure and provide, again, that context and any relevance of the measure for the committee's consideration. Or we would go to our PQM membership and bring in those subject matter experts as needed.
Thanks, Matt. I can take this next one, which is a little bit of a detour. So folks are asking, when will the STAR website be available? So as a reminder to everybody on the line, the STAR is an acronym for the submission tool and repository that we're building for the website, which is where measures can be submitted for endorsement and maintenance review, and then where there's going to be a live record of all the measures that have ever been submitted for review, including historical measures from NQF. I will note that there is an interim version of that on the website right now. It only has the repository functionality. So you can't submit measures yet. So that ST part of the acronym is not live, but if you wanted to look at measures that have been submitted for endorsement since the history of this work, that information is in there. We are working on creating the submission functionality to be ready in advance of the fall intent to submit deadline. And you can bet we're going to be providing updates via the monthly PQM newsletter and through our other announcement channels as that gets closer. Okay, Matt, can you talk about where health equity measures and patient experience measures would fit into the new endorsement and maintenance standing committee categories?
Yeah, sure. So it really would depend on what other focus or what the measure is really trying to achieve, or even considering, you know, the care setting of the measure to really understand where it would fit across those 5 projects. So health equity can appear in almost every single one of those projects. So including patient experience, right? So it just depends on where in the patient journey that measure is really trying to focus on, again, in looking at potential care settings, et cetera. We are currently right now, of the 400 plus endorsed measures that are from NQF, we are currently going through a mapping process where we're mapping all of those measures to these 5 projects. And this will be what we provide updates within the PQM website on the measure search tool, as well as the individual project committees as well on their web pages. So that is currently being done now. We're looking to have that done by midsummer. From there, we will then be able to also identify the measures that we may want to consider reaching out to developers about for readiness and being able to move measures to another cycle. Like I mentioned previously, there are current maintenance cycles already in place. We are taking a look at those maintenance cycles and layering on that measure mapping to really determine the readiness of developers, the measure load of those cycles, and then reaching out to those, like I said, in the next couple months to assess whether or not the measure needs to be moved. And that means assessing it with developers and stewards. It needs to be moved to another cycle, or it can come through for this first cycle or even subsequent cycles after that. So the mapping work will be done later in this summer. And from there, we'll also be starting to reach out to developers and stewards of measures that are both for the fall 2023 and subsequent cycles on readiness and the ability to potentially move measures downstream to another cycle. So that will be happening in the next couple of months.
All right, let's give Matt some breathing room, and I'll turn it to Nicole for this one. Nicole, the question is, will this new endorsement process be separate from the previous measures under consideration or MUC process for recommendations to CMS during the rulemaking process? And if so, what will that MUC or MAP process look like?
Great question. So the measures under consideration process, where you submit your measures to CMS through the Merit website, stays the same. That's not changing how you submit your measure for CMS to consider. The measure applications panel, or MAP, is transitioning to being called primer, or the pre-rulemaking measure review process. That process is not it's not the same as it was before. It closely looks like the one that we're presenting today with some variation. That guidebook is also posted on our website, and we are doing a webinar specifically for primer coming up as well. So please check out our website, look at that guidebook, and then we will be happy to engage with you during that webinar and answer all of your questions about primer there.
Thanks, Nicole. And we just got another question that's relevant to what you just talked about. So I'm going to flip it back to you. Sorry, I know you just took your camera off. But the next person is wondering whether measures can skip the E&M process and go straight to primer.
Sure. So you can. There's no requirement that a measure that goes through the MUC process or is submitted to CMS for review to be added to one of their programs has to be endorsed. However, if your measure is endorsed, then you have already had it reviewed for being safe and effective and have sort of that status of being an endorsed measure when it's going through the pre-rulemaking review process. So we certainly love and encourage measures to be endorsed before primer, but that's not a requirement at this time.
Thanks, Nicole. Okay, we got a question related to evaluation criteria. So can we talk to any envisioned plan to reassess the current CBE evaluation criteria, especially given the national push to digital measures and equity? So thank you for that question. It's a great one. I would say there's sort of a two-part response to that. So the first is in the interest of continuity and knowing that folks that are coming through endorsement right now have been testing and preparing for endorsement for the last several years, more than likely, that it would be probably infeasible and unfair for us to change any of the endorsement requirements at this time. So to ease in the transition and to maintain continuity with the blueprint, we don't envision any near-term changes to the evaluation criteria. Having said that, we have reworked some of the submission forms in an effort to make them a bit more streamlined. So the criteria that measure developers are being asked to speak to have not changed, but the format in which we're requesting that information is somewhat different. Now, I really appreciate the question about thinking through national priorities and changes to what's important about quality measures as we, as the field matures. And I would say that these are exactly the types of questions that we're looking to explore with the scientific methods panel as we move forward. So really making sure that we're staying on the sort of front end and the cutting edge of both measure science and the policy arena around quality improvement to figure out what, if any, role the CBE has in advancing those areas and what changes, if any, need to be made to the evaluation criteria. If you are a measure steward or a measure developer concerned about what that means for your own measures, again, there's no worries in the near term, and any changes that we're thinking of making to the evaluation criteria would go through public comment first and would probably be sort of implemented on a graduated calendar so as not to unfairly affect those submitting measures before those changes were made. Okay, we got another question. Measure developers often hold public comment periods during the development process. Are measure developers still expected to hold public comment periods as suggested in the blueprint? I would say that there is nothing in our process that should change the way that you as a measure developer interpret your role as described within the blueprint. The blueprint is still sort of the gold standard for how to develop and test quality measures. If you're using the blueprint as your guidance, I think anything that happens with the CBE falls within that measure implementation phase that happens after testing. So any public comment periods that you would already hold as part of measure development should change, or, I should say, are sort of agnostic to the steps that are in the process, because the questions that you would be asking of the public are very different during development and testing than they are once they get to the phase where they're being considered for endorsement. So that was a long way of just saying that none of the things that we're describing here today should change the process that you follow to develop measures. The processes we're describing today really just impact how we're going to be coming to consensus about endorsement and maintenance. And I hope that answers that question. Matt, I'm coming back to you. I think actually, this next question is just about whether there's any major changes compared to NQF that measure developers should keep in mind regarding the endorsement criteria. I think I already sort of answered that. No, at this time, there aren't going to be any changes to the endorsement criteria, just the forms themselves. Okay, this one, Matt, I'm going to actually turn it to you. There were measures posted on the PQM website with a comment period ending on June 25th. Are those measures following a different path than those described today? So these would be spring 2023 measures.
So they're following the path of the NQF process because that cycle kicked off while at NQF. So the protocols of procedures will be the same for those measures that were open for public comment until June 25th. So those are the spring 2023 measures, like you mentioned, Brenna. So there will be a measure evaluation meeting those meetings will happen in the first week of August. There'll then be a public comment opportunity post meeting, as well as a post comment meeting, and then ultimately a CSAC meeting. And for spring 2023, that's going to be the first week of December. So it is a different process than what we've talked about here today, because those cycles initiated while at NQF. So the processes and protocols will follow the NQF processes and protocols. And I said both cycles. Fall 2022, which is further along, we've conducted post-comment meetings on that, and now we're moving to CSAC. And then spring 2023 is going through the measure evaluation meetings that will happen in August.
Thank you, Matt. Okay, Nicole, can you talk a little bit about how we're going to navigate determining and then making known whether any public comments that we've received are associated with any conflicts of interest that the public should be aware of?
Sure. So I think in general, public comments may come with conflicts of interest, if you want to call it that, because people are meant to sort of comment on the behalf of their perspective, and that might be the perspective of the organization it's going to impact or the person it's going to impact. If the question is if the measure developer submits a public comment, I don't know that that's something that we have seen, but we can certainly state when that is the case. Usually the measure developer supports kind of responding to the public comments rather than putting in a question themselves. So we are accepting public comments from everybody who wants to submit them. You will be able to see them on the website in relationship to whatever is being commented on. And so we want to have that level of transparency. You should be able to see what comments have come in, and then also see them in reports that are coming out later as we publish sort of how the endorsement decisions were made. So overall, we never want anything to happen that feels like it happened behind the scenes or in a black box. Everything should be transparent from the second that the measure is submitted through the final endorsement decision. Should be able to track that and see how it went through and how the final decision was made. If you don't feel like it is obvious, please always feel free to reach out to us so that we can help rectify that.
Thanks, Nicole. So I can't believe it. We've gotten so many good questions, and there are dozens more that I know we don't have time to get through. We do have a few wrap-up slides that I want to make sure we cover today before we sign off, but just to reiterate, we are not going to be ignoring any of your questions. We are going to do our best to reply to those in writing following the meeting, and we'll try to get that FAQ posted to the website, and we'll send out an announcement to participants after the fact, letting you know when those have been posted so that you can see. And of course, if you don't see a response to your question, you can always reach out to us via email, and we'll do our best to get back to you, in a timely manner with responses to those questions. So I'm going to turn it back to Matt to talk us through our last few slides here.
Yeah, thanks, Brenna, and thanks to everyone for submitting all those great questions. Again, we highly encourage you do so also through the public comment opportunity on the E&M Guidebook. But if we go to the next slide, we just wanted to briefly talk about a few other engagement opportunities here. Again, becoming a PQM member allows you to stay up to date on all upcoming activities and events, as well as other opportunities to participate in this work, whether it be nominations, public comment, or other panels and advisory groups that we will convene. Membership is free. It's available to any individual or organization level. So that's PQM membership. You can be a member as an organization or as an individual. But like I mentioned earlier, for the E&M committees, endorsement maintenance committees, that's an individual nomination. So benefits of membership, obviously, is you get that notification. You're notified of public comment opportunities or other ways to engage with this process. And you can learn more by going to the link there or to the PQM website. If you, at the very top of the screen, the navigation bar, you'll see Get Involved. That's where you can become a member, but also then submit a nomination. And so there were some questions around what's required for nominations. If you go to that Get Involved site, which there's links being dropped into the chat, you can see what is required for submitting a nomination, which is the letter of intent, your CV, the application, the disclosure of interest form, which is all linked and provided there. Next slide, please. So just a few more announcements here. We've been talking about these throughout the webinar here. I wanted to at least put them all on one slide for everyone to kind of see. So for committee nominations, that opened up today. It's actually going to go till June 30th. So it's seeing how we're kind of opening up a little bit halfway through the day. We have July 1st there to the 30th, but it ends on July 30th. You can find more information about that on the PQM website. And I just mentioned, you can see what's required for a nomination. Again, that's also for primer and MSR. All right, so that's also available if you're interested to sit on that work. The E&M Guidebook is also open for public comment. So it was just released today, so it'll be open until July 30th. We will provide responses to those comments sometime in September, and some of that will be maybe making updates to the E&M Guidebook to provide more clarity on areas or any further direction that's needed within that guidebook. So we really appreciate all of your review and providing comments on that. We will also then work with developers and stewards of measures that are for the fall 2023 cycle, again, to assess readiness for that cycle. I mentioned having another webinar sometime in the September timeframe where we talk about submitting measures to Patel, and that's for any cycle. And then we will also be working with developers of subsequent cycles too, around the same timeframe to consider moving measures potentially or readiness, even that next cycle right after spring 2024. The public comment opportunities. We also have two of those cycles that are currently ongoing that were kicked off at NQF. So we have the fall 2022 CSAC meeting that's going to be on July 24th to July 26th. During that meeting, there's a public comment opportunity for measures that will be discussed and reviewed by the CSAC. For spring 2023, again, that's the second cycle that kicked off at NQF. There are public comment opportunities during the measure evaluation meeting. There was one that was open for June 5th, till July 25th, June 25th, geez, excuse me. And that was to submit comments for the committee's consideration during this endorsement review for the spring 2023 measures. But there will also be an opportunity during the actual evaluation meeting to provide public comments. There's also the post-evaluation public commenting period. So that'll be a 30-day window where, it'd be less than 30 days to where stakeholders or interested parties could submit comments based on the standing committee's recommendations, and then the CSAC meeting as well. So again, you can have an opportunity to provide public comments during the CSAC meeting for spring. Finally, there's the fall 2023 E&M rosters. So after the nominations period, we will be posting the rosters for public comment. So that will be to look at again, the topic area of the project and the committee members and their expertise. You can comment on that as well. So that will be happening after the nominations period closes. And lastly, if you're interested in learning about the pre-rulemaking review and the Measure Set review process, these were formerly the Measure Applications Partnership. There will be an informational webinar on July 10th. You can find out information on that and register for that by going to the PQM website. You also have the opportunity right now to review their guidebook, which was published recently, but that closes on July 21st. So July 21st is when that public comment opportunity on their guidebook closes. So if you're interested in learning more about that and want to actually submit comments, you can do so with these two opportunities. Next slide. If you do have any other questions related to what we've discussed, or as you're starting to interact with the website, and also if you're a developer thinking about submitting measures, you can contact PQM support at pqmsupport@battelle.org. And so our team will be monitoring for those emails that come through and answer any questions in a timely fashion. And next slide. And then lastly, just wanted to recognize this great team here at Battelle for all the work that they've done in gearing up for this webinar, as well as the guidebook and rolling through this process. I also want to thank all of our attendees on the call today from all different perspectives, developers, stewards, any interested party from involved in this work. Thank you for your time and your interest in this webinar. And I will also turn it over to Brenna and Nicole to see if they have any closing remarks before we adjourn.
Just once again, gratitude for you taking the time to participate today, for all of the amazing questions. We are looking forward to continuing to engage with you in the coming weeks, months, and years. Brenna, what would you like to say?
Just to echo that sentiment, and again, to remind folks that this is not a cursory public comment period. We really, truly are looking for your inputs to help us identify any potential pitfalls with the approach that we need to mitigate, and to make sure that we are, balancing the needs of all the crucial stakeholders that contribute to this work. So really appreciate your engagement today. Looking forward to digging into your questions and comments in writing after the meeting, and looking forward to more conversations as we dive into the work. Thank you all.
All right, and with that, we wish everyone have a nice weekend. Also have a safe and enjoyable holiday, and we will definitely be in touch. So thank you all very much. Have a good weekend.